With over half of all people today enrolling into Medicare Advantage plans, and sadly many of them for the wrong reasons, I think it's important that Medicare beneficiaries understand that on the surface, Advantage plans look very appealing. In fact, you listen to the ads and the agents, and there are some truly positive aspects about Advantage plans. However, when you look beyond the surface and really try to understand how Advantage plans are going to work, especially if someone has some serious health issues and is actually going to need to use their insurance, you will quickly find that Advantage plans are going to lose their appeal. Now, frankly, many agents will not tell you the truth about Advantage plans, and the reason for that is because we make more commissions on Advantage plans. But in this video, I'm going to tell you the truth. And what I'm going to do is share with you a couple of real-life stories of people who enrolled into Medicare Advantage plans and came to regret that decision. Now, as we begin today's video, I just want to mention a couple things, especially for those of you that are familiar with our channel. My normal format and teaching is to stand at a board, a smart board, and we go through the content of the video and me drawing things, explaining things. Today, a little bit different, just sitting at a desk because what I've done some research about Advantage plans and have come across some content that are just, I'm going to have to read to you, but I think it's important. I think the details really are surprising, quite frankly, shocking. And so that's why I've chosen to present this material in this particular format. The second thing I want you to realize is that I am not specifying any particular insurance company's Advantage plan that is guilty of this, because they're all guilty of this. They all function the same way and have these same type of problems that we're going to talk about today. So again, not picking on any insurance company, just showing you how Advantage plans do work when people get sick. All right, so we're going to talk first off about two individuals. One, her name is Jenn Coffey. The other is Gary Bent. Now, let's begin with Jenn. Now, Jenn Coffey was sick. She was on several medications. She was in and out of the hospital. And then she made a decision that she has come to regret. Jenn's still alive today, as this article is talking about her situation. So here's what happened. Having fought off breast cancer, this former EMT, emergency medical technician, faced numerous complications and was diagnosed with two rare diseases. One of them was called complex regional pain syndrome, and the other one was called small fiber neuropathy. All right, so just a little bit about that to kind of really understand the severity of her situation. So this complex regional pain syndrome is a chronic pain disorder that can affect the arms, hands, legs, or feet after an injury or a medical event. It's characterized by pain that's disproportionate to the injury and then lasts longer than expected. It also causes sensory, motory, and autonomic abnormalities such as swelling, sweating, changes in skin color, muscle spasms, joint pain. And so what happens, it's triggered actually by trauma, fracture, surgery, strokes, or heart attacks. And sometimes even after some kind of an injury or an illness that has nerve damage. All right, now, here's the point. This disease she has can sometimes go away on its own over time, but in some cases, the symptoms last long and can even worsen. Here's what happened. Treatments include pain medications, therapy, electrical nerve stimulation, injections into the nerves. But if it's left untreated, it can make it very difficult or painful to move and really affects lots of limbs. And so while this disease doesn't directly affect life expectancy, if it's untreated, it can lead to serious lifelong disabilities and other health conditions. All right, so that's one of her issues. The second one was called small fiber neuropathy. What this is a peripheral neuropathy that occurs when small nerve fibers in the skin are damaged. And these nerves are responsible for transmitting information about pain and temperature to the brain, as well as some other sensory functions like feeling, light touch, limb positions. So when this small fiber neuropathy occurs, the brain receives different signals, which then can lead to symptoms such as painful tingling, burning sensations in the hands or feet, abnormal skin sensations, decreased sensation. All right, so this disease, small fiber neuropathy, affects small nerve fibers that control essential body functions such as heart rate, blood pressure. So it starts with mild discomfort, but it can eventually become debilitating, and that's what this lady is going through. Pain attacks can be more severe at night or during periods of rest and may affect other areas of the body. What's it caused by? Well, it's caused by, number one, metabolic conditions. It could be hereditary, infections, immune-mediated conditions. So someone has an immune disorder and they're trying to resolve that. diabetes, deficiencies of vitamin B12, alcohol use, exposure to chemotherapy, physical injuries, illicit or overuse of prescription medications, autoimmune disorders, and on it goes. Treatments for this can include antidepressants, anti-seizure medications, lidocaine creams, patches, narcotics, or opioid-based pain medications, and immunosuppressive drugs. So as you can tell, very serious. Both of these things somewhat serious as well as very painful. And that's what she has. All right. And so I want to kind of give you the background of her. So here's what she said. She said, I was terrified. I went into the hospital, and keep in mind when this happened, she was 52 years old. I went to the hospital as a fully functional EMT, and I came out in a wheelchair. Had to go on disability. She said, I lost everything. Now keep this in mind. When someone is approved for Social Security disability in this kind of a situation, on the 25th month, they're eligible now for Medicare A and B, and that's what's happened to her. She is now on Medicare A and B. And so she originally is going to sign up for a Medicare supplemental plan to fill in the gaps that Medicare doesn't cover, but she was not able to afford that. And so what she did is she made a decision to switch off of traditional Medicare with her supplemental plan and go to an Advantage plan. So here she is now on Medicare. She said, to make things cheaper, I shifted my disability plan from traditional Medicare to an Advantage plans. Okay, now the article goes on to say this, with monthly premiums of $18.50 per month on average. Okay, that's average Medicare Advantage. And there's many of them that are zero premium. In fact, I think this year 2 out of every 3 Advantage plans have zero premium. So it says on average $18.50, Medicare Advantage plans often look like a frugal alternative. However, private insurance companies keep premiums low by limiting providers and using cost containment tools such as prior authorizations. And we're going to talk about prior authorizations here in just a minute. So for Jenn, Coffey, switching proved to be more expensive, though, as her Medicare Advantage provider denied requests to cover treatments, medications, and infusions that she required. I read through those 2 diseases and what goes on because this lady needs some very serious treatment that is very expensive. But again, the Medicare Advantage plan was not interested in covering some of these items. So here's what she goes on to say. Her experience with Medicare Advantage is not unusual. Private insurers now cover roughly half of the nation's 68 million Medicare beneficiaries. Their dominance of the Medicare space has grown rapidly over the last 2 decades at the expense of patient care, according to healthcare activists and patients, as corporations often deny medical care directed by doctors. Okay, so that's Jenn Coffey's story. Again, I'm going to tell you a little bit more about her in just a minute. Now, let's insert the second story, and this is a gentleman by the name of Gary Bent. Gary Bent was actually a retired physicist professor from Connecticut. Now, what he fought health-wise was 2 types of cancer. One was Hodgkin's lymphoma, and the other one was metastatic melanoma. And he fought this cancer over a 6-year period of time before he passed away last year, March of 2023. Okay, so here's his story. He had been put on a Medicare Advantage plan as part of his retirement health coverage through the University of Connecticut. And again, we're seeing this more and more and more, where companies, employers who have promised their retirees benefits in retirement, they're moving their people to Medicare Advantage plans, and sometimes that's the only option. All right, so that's what happened to Gary. Now, his wife, Gloria, said this, I was stunned when Gary was denied coverage for his brain surgery. She says it was only the start of their issues with their Medicare Advantage plan. So we're going to insert Gloria, his wife, and the daughter Megan into the story. And so here's what they said. After spending the final months and years of his life battling with his Medicare Advantage plan software, which constantly denied covering Gary's medical care and treatment, contrary to doctors' recommendation. And that's the point. So now what they're struggling with, he needs serious treatment, but there is a computer system that's used by Advantage companies, and they have algorithms and all kinds of data in there. And so the software system, the computer system is saying, no, we're not going to cover this. And so now they're going to have battles with them, with the insurance company to get his proper care. And here's what they say. Each denial forced them to either cover the cost themselves or consistently file appeal after appeal after appeal. As you'll see here in a few minutes, if they deny the coverage, you do have the right to appeal. But again, that's going to take time. And so let's keep going. So his wife, Gloria, says this: you're worried about your loved one who is in a medical crisis. You're trying to get there to support them every day, and you're having to fight these online battles with the health insurance company to try to keep them there. It's just a horrendous additional stress. She was informed by both her husband's doctors and other experts that she contacted for assistance over this problem, that the modus operandi of Medicare Advantage private insurers was to deny medical care coverage. The daughter says this: it felt just so cruel, like they weren't thinking of my dad as a person. They were just thinking about him in terms of profit or dollars and cents. Gary himself was really upset at the way he was being treated and was stressed out about money. All right, now I want to tell you about a gentleman that was an activist. He has since passed away, but in 2022, he started an organization called Be a Hero. His name is Barkan, and he became very concerned about Medicare Advantage plans, and this first surfaced in his life in 2022. So he starts this program, and he's making comments about Medicare Advantage plans. So here's what he says: the private programs surge in enrollment, and again, over half of all people today on Advantage plans, is not going to be good for the American people, because it will be a system that consistently delays and denies people care for profit and continues to give away billions of dollars, billions, folks, to corporations that are actually not best positioned to decide on our health care. But the expansion of Medicare Advantage has been immensely profitable for private health insurers that are tied to the program, who enjoy high gross margins compared with other plans. Over the next 10 years, Medicare Advantage insurers are expected to receive more than $7 trillion in payments from the federal government. Private insurance have spent millions of dollars. These companies that have Advantage plans have spent millions of dollars on advertising, marketing, and hiring insurance brokers to sell their Medicare Advantage plans to beneficiaries. And again, as I said, agents who really promote these and sell them, and some that's all they want to sell, they do so because there's a higher commission than what we would get on just traditional Medicare with a supplemental plan. Okay, now a lady whose name is Rose Roach, she's actually executive director of the Minnesota Nurses Association. Here's what she had to say. She said, I don't think when it comes down to it that most people realize the extent to which private equity and privatization is moving into Medicare and Medicare Advantage. They are buying up pieces of the entire healthcare system in this country. Medicare Advantage plans were initially added to Medicare based on claims, and this goes back to the early 2000s, that they would provide savings for the federal government. That was their promise: better care, better price. Here's the reality, and this came from a report to Congress from MedPAC, which is the Medicare Payment Advisory Commission, and they noted this: that many iterations of full risk contracting with private plans have never yielded aggregate savings for the Medicare program. Okay, this full risking contracting means Medicare Advantage plans. Throughout the history of Medicare managed care, the program has paid more. Again, Advantage plans have paid more, sometimes much more, than what it would have paid for beneficiaries otherwise. So many healthcare activists, patients, and family members have claimed that the quality of Medicare Advantage plans were poor when they needed them most. This was out just recently. I thought this was a very interesting article. Here's what they said as they tried to, and this is a nonprofit organization reporting to the government about Medicare Advantage plans. Here's what they said, and the title of this is Quality in Medicare Advantage. The current state of quality reporting in Medicare Advantage is such that the commission, this commission who writes the report, can no longer provide an accurate description of Medicare Advantage quality of care. Beneficiaries, people on these plans, lack good information on the quality of care provided by MA plans in their local market, limiting their ability to make informed choices among the plans. Further, the 49% of eligible Medicare beneficiaries enrolled in MA plans do not know how their plan quality compares with original fee-for-service Medicare. And so this is the commission saying we do not believe the quality of care is being delivered that was promised to be delivered. Let's keep going. Now, this comes from a lady whose name is Megan Essahab, and she's actually the director of a program of federal affairs called People's Action. Here's what she said. They're taking in more money, Advantage plans, and providing less care. That's the formula. That's how you make profit. She goes on to say this, as Medicare Advantage takes over the market and traps people in it, then they're able to worsen their care. So again, the greater in popularity these programs grow and the more people enroll in them, these companies get this money and they're not willing then to provide the care that they have promised to deliver. Okay, that's a reference here. Just one more here. This comes from a person by the name of Carly Morton. She's out of Beaver, Pennsylvania. So here's what happened to her. So she switched to an Advantage plan. Why? Because the additional benefits, and that's what they always want to talk about, the dental and the vision and the hearing aids and gym membership and all those things. And she switched for that as well as the cheap premiums. Okay, and meaning she said I was basically enticed by these things to enroll into an Advantage plan. But here's what happened. She says it was a disaster that took a really huge toll on me. Okay, she needed actually a life-saving surgery to treat her rare vascular condition. And so what happened was the insurance company was denying that. They were fighting her. Here's what she said. Not getting the surgery would mean either dying or being very, very sick for the rest of my life. She said, I really got depressed for a while because I thought that was what was going to happen to me. So here's what happened. She finally got her surgery approved once she went public and launched this public campaign against the insurance company, got their attention and the bad press they were getting, so they approved it. All right? And so that's what's happening. With people, multiple people all over the country. Now, let's go back to Jenn Coffey. Let's finish up the story here and the video. So Jenn Coffey, remember, she was the former EMT. Right now, as it sits, she's in her mid-50s, and she cannot switch now from her Medicare Advantage plan until she hits 65, because she made that decision to go on the Advantage plan. And so then what's going to happen is she's going to have a second opportunity to be able to enroll into another plan once she hits 65. So she was eligible for Medicare because of disability, and now she'll be eligible at 65, and then she can return to original Medicare and then get a supplemental plan because she has what we call the initial enrollment period 2, so a second chance. So for the next 10 years, she's still going to be in that plan. All right, so she's still on the plan today, and so what she's doing presently on her Advantage plan, she says this, I'm rationing my treatment infusions because my insurance company will not cover them, along with several other medications. The infusions make the difference for me being able to walk around, cook myself a meal to have a semblance of dignity in life. Spreading them out takes away that dignity. It makes it difficult to walk to the bathroom. It causes a progressive decline. She says, I don't want to die. If I can't access my medications and treatments, if I can't stay on top of everything, I decline. And she says, I'm not ready for that. All right. And so again, for the next 10 years, she's going to have to undergo these complications. Why? Because of that decision to enroll into that cheap Advantage plan. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, just last year, Jenn Coffey, actually, after she'd gone public with her story, she still found herself pushing for the insurance company to cover her treatment, seeking prior authorizations for care and going through appeals over the denials. Here's what she said. According to her, she had had prior authorizations accepted by the insurance company, means they approved it, only for the insurer then to not follow through with paying for that care, forcing her to regularly spend hours on the phone speaking with customer service representatives on hold, trying to resolve the issues. She said this, it's ridiculous and disgusting that an insurance company has the power to tell my doctor, no, you can't give that patient that. No, you can't have that drug that might help you live. She said it's disgusting that we allow it, and insurance companies do nothing to increase positive outcomes in healthcare, absolutely nothing. And then let's go back to Gloria Bent. Gloria Bent, of course, her husband Gary was 6 years under cancer treatment. He ends up passing away, and she said this: Medicare Advantage works well until it doesn't. Okay, Gary died last March, and she says, and when it begins to not work well is when you most need it, when you're in a medical crisis and you need advanced care. All right, and so these are some of the items that people have to deal with. And again, agents don't talk about this. Agents want you to buy an Advantage plan because the commissions are going to be higher. But someone who genuinely cares about you is going to talk about all your Medicare options. And there are sometimes people have to have an Advantage plan because they just simply cannot afford a premium for good quality medical coverage like A and B and their supplemental plan will offer them. So there are times that has to happen. But many people could afford a supplemental plan and get that high quality medical coverage. They're just not aware that if they enroll in an Advantage plan, this is what they could easily experience. All right, so that's the issue with them. Now, I also want to talk about a couple other aspects, and that is I want to show you some things that are actually from an Advantage company's website as they talk about pre-authorizations. And again, agents are not going to tell you this stuff, but I'm here to tell you when you dig into these plans and look at the fine print, you're going to see that many, many times prior authorizations are going to be a part of what you're going to have to experience. So you can see here on my screen, okay? And again, there's several of these, but I'm going to share a couple of them with you. You'll notice the paragraph here that we're highlighting. Some services require prior authorizations from the plan in order to be covered. Obtaining prior authorization is a responsibility of the primary care physician or the treating provider, which could be a specialist or a surgeon. Services and items requiring prior authorizations are listed in the medical benefits chart in this particular company's Chapter 4. All right, let's keep going. Here's another one. Now notice what this book, by the way, it's called An Evidence of Coverage, and all companies put these out. So here's what they say. You don't need to get a referral or prior authorization when you get care from out-of-network providers. Now keep this in mind. If you have an HMO plan, you can't go out of the network at all. You have to stay in the network. So this is clearly an evidence of coverage document from a PPO plan. You can go out of network on a PPO plan. But look what happens. So even though they're saying you don't have to referral or prior authorization, however, before getting services from out-of-network providers, you may want to ask for a pre-visit coverage decision to confirm that the services you're getting are covered and are medically necessary. Why? Look at the next statement. Without a pre-visit coverage decision, if we later determine that the services are not covered or were not medically necessary, we may deny coverage and you will be responsible for the entire cost. If we say we will not cover your services, you have the right to appeal our decision to not cover your care. And that's exactly what we read about. These other people had certainly experienced having to go through that appeal process after it was denied. You'll notice in this particular company's evidence of coverage, ambulance services, look over to the right, your provider may need to obtain prior authorization for non-emergency transportation. Look at this one. This is a company that has the benefit of a hearing aid service. You must obtain prior authorization from the company in order to get those particular hearing aids. This next one, look at the paragraph. For services that are covered by Medicare A and B and are not related to your terminal prognosis, by the way, this is in context of someone that is on a hospice care. Okay, they're on hospice, meaning they've been diagnosed with a terminal illness. If you need non-emergency, non-urgently needed services that are covered under Medicare A and B and that are not related to your terminal prognosis, your cost for these services depends on whether you use a provider in our plan's network and follow plan rules such as what? If there's a requirement to obtain prior authorization. Again, there are going to be some services that are going to be required to be pre-authorized even in this terminal type of a condition. Let's keep going. Another issue with prior authorizations here, getting plan approval in advance. For certain drugs, you or your provider need to get approval from the plan before we will agree to cover the drug for you. This is called prior authorization. This is put in place to ensure medication safety and help guide appropriate use of certain drugs. If you do not get this approval, your drug might not be covered by the plan. Again, having to live with prior authorizations. All right, and just one more, and this is kind of a summary of what a prior authorization looks like. You'll see here it says, for medical services, it means a process where your primary care physician or treating provider must receive approval in advance before certain medical services will be provided or payable. For certain drugs, it means a process where you or your provider must receive approval in advance before certain drugs will be provided or payable. Covered services that need prior authorizations are marked in the medical benefits chart. Again, there's several of those kinds of things. In fact, they say right now that 70 to 72% of the services that people need on the Advantage plan are going to have to go through this prior approval process. I personally have had clients that needed a knee replacement on an Advantage plan, and the company said, no, we're not going to cover the knee replacement. We want you to go to therapy for 9 months. Had a lady who needed a full hip replacement. Doctor said that's what they need. They went for prior approval. Plan said, no, we'll only cover a rod, and that's the only thing we're going to cover, not a full hip replacement. So those are the kind of things things that people experience all the time. Why? Because you've given that insurance company the right to have the final say-so with many of your healthcare services. If a person that is on A and B with a supplemental plan, they would never experience this kind of intervention or interference, delays and denials by the supplemental plan, because the supplemental plan, if A and B pays and covers it and doctor says you need it, then the supplemental plan is going to cover their part as well. They have to. Again, they can never interrupt any plans at all that your doctor has for you. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, that brings us to the second thing, and really the final thing I want to share with you. We know clearly that pre-authorizations are a problem today. But the second problem that is surfacing now is becoming more of an issue as well, and that has to do with networks. You see, Advantage plans are always going to be a network type of a plan, either an HMO or a PPO. HMO plans have a smaller network, PPO is a little bit larger, but they're still going to be a network plan. And so what happens is providers that enter into a contract with the HMO or PPO are saying we'll treat patients at this certain dollar amount, and they enter into this financial business agreement. But if they don't like that agreement, the providers, they can pull out of those markets, and that's what we're beginning to see. In fact, there's an article I have right here that says hospitals are dropping Medicare Advantage plans left and right. Even though half of all people that are covered by Advantage plans, this article says that a number of hospitals and health systems nationwide are pushing back and dropping some or all contracts with the private plans altogether. Why is that? Well, among the most commonly cited reasons are excessive prior authorization denial rates and slow payments from insurance companies. Some systems have noted that most Medicare Advantage carriers have faced allegations of billing fraud from the federal government and are being probed by lawmakers over their high denial rates. This gentleman runs a hospital group out of San Diego, and he said it's become a game of delay, deny, and not pay when it comes to Advantage plans. All right. In fact, his particular group was notifying patients that it is terminating Medicare Advantage contracts for its integrated medical groups, and it's going to affect about 30,000 people in that particular region. Okay, this is happening everywhere. I've got an article here from an insurance company. Here's what they say. Despite months of hard work, our best efforts to reach a compromise, this Advantage company was unable to reach a contract agreement with Trinity Health of New England in Connecticut and Massachusetts. As a result, Trinity Health of New England is now out of network for members that are enrolled into this Advantage plan. Okay? And says, while we remain open to discussions with Trinity Health of New England, currently our primary focus is, and yada, yada, and all they go. Okay, so that was that one. Listen to this one. Another one, despite months of hard work, our best efforts to reach a compromise, we were unable to reach a contract agreement with St. Mary's Health in the state of Georgia. Another one here. They say here, despite months of hard work, our best efforts to reach a compromise was able to reach a contract agreement with St. Joseph Health System in Indiana. And on it could go. Why? Because these places are dropping these Advantage plans. Because why? Delays, denials, pre-authorizations, slow payments, those kinds of things are beginning to happen more and more. Just one more article on this. Interesting. This is actually a company that's an Advantage company reached out to us, and they wanted us to know that there was a large hospital group and pain surgery center group that actually dropped the plan. Here's what they said. And this is, again, from the insurance company. After prolonged discussions, we've been unable to secure an agreement with this particular hospital group. As a result, the following hospitals and surgical centers will no longer be a part of our network, both HMOs and PPOs, beginning August the 1st. And they list 15 facilities, 8 hospitals, and 6 surgery centers, and 1 pain management clinic. They said members who have accessed care at any of these facilities within the past 6 months will receive a notification regarding these changes. And this letter will inform that effective August 1, these providers will no longer be in our HMO or PPO network. Now, if they're under care, they can continue on as long as the doctor fills out paperwork. But if they're not under any kind of care, they can no longer go to this particular facility. Also, listen to this one. This is actually a Medicare Advantage plan that has 33,000 members. And here's what they say. Medicare Advantage plans across the country continue to be challenged by heightened regulatory demands and rising market and financial pressures. Despite our actions to create a more viable, scalable solution for our valued Medicare Advantage members, the required financial investment is not sustainable. What are they saying? We're not making enough money. Okay, even though they're a large nonprofit health insurer and they have 33,000 people, they're dropping out of the Medicare Advantage market at the end of this year. All right, and so my whole point in sharing all this with you is this. Just because an Advantage plan has these extra perks, dental allowance and a vision allowance and maybe some hearing aids and a gym membership and some of these things that really sound wonderful, the reality is that all those things will mean nothing to you if you get cancer and now you have to undergo the situation that these people had to undergo, meaning you're going to have to go through pre-authorizations and you're going to have to really see that your network could be restricted. That's what's going to matter to you. Sure, agents pushing because you make more money, but the question is that Advantage plan going to give you a better quality of healthcare insurance? I personally do not believe so. And so when you make the decision, even though Advantage plans, again, look great on the surface, please take the time to dig deep to make sure you understand how those plans are going to work.